Oh, hi, Dr. Watt.
Hello.
So, can you introduce yourself to our listener?
Hi, I'm Dr. Watt. I go by May outside of clinic. I graduated from NUS dentistry and subsequently did my master's in orthodontics also in NUS. Currently, I'm working in private practice, practicing orthodontics as well as other aspects of general dentistry.
Can I ask what got you interested in dentistry?
My dad's a first generation dentist. So the story of how he became a dentist is actually quite funny because back then there weren't many dentists out there and people didn't really have the habit of seeing a dentist regularly. He saw that the government was trying to encourage people to become a dentist. So he signed up and decided to become one himself. So growing up, I saw him run his own clinic and run his own practice. So there was always a part of me that was curious about dentistry. And I also wondered how dental students train day to day. And there was also a part of me that wanted to be in healthcare as well, so that I can have a direct, tangible impact on someone. So the funny thing is that I was actually very scared of the dentist growing up. I don't know how my dad put up with me, but every time I went to the dentist, I would always be like, Daddy, I'm so scared of pain. Will this be painful? Actually, it was quite funny because going into dental school actually helped to desensitize me to dentistry because we will always practice procedures on each other when we train.
What do you think is the most important traits of being a dentist?
So like any other healthcare profession, of course, you need to have the heart to help people. And I think besides that, I think one of the most important trait actually is being very resilient because dental school is not going to be easy. At every stage, you will probably be questioning yourself whether you are right for this, whether this is meant for you. And there are some times where you are thrown in some situations where you really just feel like quitting and giving up. And even after dental school, I think at every stage of your career, there will be challenges as well. Dentistry can be very unpredictable and sometimes you can do everything right, but you may not get the outcome that you want. So being able to reset and move on is very important in this career. If not, it will lead to a lot of burnout.
So, do you need a naturally good hand skill to become a dentist?
So during the admissions process at NUS, there's a manual dexterity test. If I'm not wrong, I think it's a wire bending, soap carving, as well as
What?
plasticine molding.
Oh, wow. I think I didn't know about that at all. About why do they need that?
So I think the test is just meant to see if you have a baseline, whether you are good with your hands, I guess. Yeah, but I don't think it's a good indicator or a good predictor to a certain extent of how well you will do in terms of dentistry skills. So the hard truth is that when you are in dental school and you start dental clinics or dental preclinical, you're practicing dental procedures, right? You will kind of realize that hand skills come naturally to some people and it may come more easily to some people, but it's also something that can be practiced and can be developed over time with repetition. So even if you realize that you really have the natural talent for hand skills, you don't have to worry. It will come with time as well as practice. So I would say don't be too hard on yourself.
Do you consider yourself to have naturally hand skills?
No, not really. During dental school, we have to take certain competency tests and all that. So you will only pass the test if you demonstrate during the test that you have reached a certain level of mastery. I failed my preclinical competencies quite a few times. The first competency that we had to take was an amalgam competency. So it's like a metal filling, which has kind of mostly been phased out already. And I think I failed that a few times. And then the second test that we had to do was the crown competency. It was quite a funny story. So I actually failed the crown competency once because while trimming the crown, the provisional actually fell on the floor. And then I remember I was in panic mode and then eventually I failed the test because I had nothing to show. And then after the test was over, right, actually I found the provisional on the floor. It was underneath my fake Oscar head.
And then you had to retake the module.
Yeah, so I retook the test, I think 4 or 5 times before I passed. So sometimes I post stories of my dental school journey on
You
socials.
put it there?
Yeah. Sometimes students will message me and, oh, thank you for sharing my experience. At least I know that I'm not alone.
Definitely. Well, I think just hearing from her, right, the dentist school, it sounds really challenging already. So I'm gonna go in deeper. Okay, so what is the most challenging part of being a dentist student?
I think the most challenging part of being a dental student is trying to wear too many hats because you have so many roles and so many responsibilities. When you are a dental student, you are the receptionist, you are the dental assistant, and you are the dentist also, and you are the patient treatment coordinator all at the same time. As a dental student, we had to find our own patients, schedule their own appointments, and we also have certain clinical requirements, which means we need to complete maybe like X number of cases before we can graduate. So we have to find our own patients to meet that requirements as well. Finding patients was definitely a very challenging part because we also weren't allowed to advertise or solicit or post on social media. So most of us would ask around our friends, our family, our relatives. And sometimes it feels very frustrating because no matter how hard you work, if you can't find patients and some things are just out of your control.
Yeah. Now that we have touched on school, I think the burning question for student would be local or overseas, and how should student approach that?
So if you want to study dentistry locally, there's only one dental school. It's an undergraduate 4-year program here at NUS. If you want to study dentistry overseas, then you can either do it as an undergrad degree or as a postgrad degree. I think the most significant factor would actually be cost because studying overseas can be very, very expensive. A lot of people have talked about dental school loans and debt. I would think if you do a dental degree overseas, it would cost at least $500,000. So the other consideration I think students should know about is where they plan to practice long term. Because if you have a degree in Singapore, it might not be recognizable elsewhere. So if you're planning to migrate or move out of the country, then that's something you have to consider because different countries have their different exam and licensing requirements as well. Yeah. There's some recent changes in the council guidelines. So if you are doing an overseas dental degree and coming back to Singapore, there should be an exam that you have to take before you can practice here.
So I know that dentistry have many specialties, and one of it that I know is orthodontic. So can you share with me more what is like orthodontic?
So in dentistry, we have many different specialties. There's endodontics, which deals with root canals, the dental pulp. There's periodontics that manages gum conditions and soft tissues. There is pedodontics that manages children and kids dentistry and oral surgery. So orthodontics is one of the specialties in dentistry where we focus on correcting teeth and correcting bites as well as jaw alignment.
Okay, so for yourself, what do you choose?
So for me, I did my dental residency in orthodontics. Residency is a 3-year postgraduate program and I did mine here in NUS.
Okay, so why did you choose dental residency specifically?
So for me, there were a couple of reasons. Of course, the first reason was personal because I was a braces patient myself and I saw how transformative braces treatment can be. I know how much confidence a straight smile can give to someone. And the second reason is that during dental school, I really enjoyed learning about orthodontics and reading the orthodontic textbook. I think out of all the subjects, I probably read the orthodontic textbook the most. It was a topic that I was very interested in and I knew I was in the right place. And lastly, when it got to the clinical side of things, I knew I liked the clinical aspect of orthodontics more than the other specialties in dentistry.
Okay. So what are some consideration to take in before considering a residency?
I think anyone considering a dental residency definitely has some baseline passion for the subject. I think not many people know that dental residency and medical residency is very different because for medical residency, during your residency training, you actually pay a stipend or a salary. But as a dental resident, you are paying school fees and you're not earning a salary. So I think the financial commitment and opportunity cost of pursuing dental residency is very high. Of course, there could be other personal reasons as well. Maybe you have a family or you have children, whether you have enough time to commit to the program. The other thing about residency is that given that it is a full-time 3-year course, the amount of understanding and knowledge that you will gain from this program is very different from a weekend or shorter term course. So this program is really for someone who wants to have a very good understanding and someone who wants to dive very deep into the subject.
So, is there anything about orthodontic that you wish people knew?
Definitely. So it's a common belief that you have to wait until all your adult teeth come out before you start orthodontic treatment. And while that's true for some cases, it's not like a universal rule. There's something called interceptive orthodontics, also what we call early orthodontic treatment, that I think needs more awareness. So certain things like growing the jaws or growth modification or correcting impacted teeth can only be done when the child is still growing. And oftentimes when we treat early and we intervene early, and it prevents the problem from becoming worse. So treating some problems early actually make them easier and simpler to address rather than waiting until they become more complex issues later on. But that said, it works both ways because for certain conditions, when we intervene too early, it actually causes treatment burnout. Sometimes the issue may worsen with growth anyway. So while there are cases where we intervene early, there are some cases that we would prefer a watch and wait approach. It really comes down to proper evaluation of the case. But the key message is this: early assessment doesn't always mean early treatment, but it ensures that nothing is missed.
Okay. Just now you mentioned you wore braces before, right? So how did that experience shape the way you practice now? Because you were once a patient as well.
Yes, so I was a braces patient myself. So after PSLE, my dad took me to his friend, an orthodontist, to get braces done. So I remember I was so nervous before the day of the consultation. The main reason why I was so nervous was because I would get the verdict then, right, whether I needed to extract any teeth or not. So of course, 12-year-old me, I only cared about whether I had to extract teeth because the idea of extraction is just so scary for a young girl, right? After I went for the appointment, I just got one of the biggest shocks ever because they discovered that I had an impacted tooth, which was buried under my gums at the upper. My orthodontist also told me that I had to extract 4 other teeth. And of course, being 12 years old and knowing nothing, I actually begged my dentist, can you please don't extract? Then I asked for a bargain discount, can we don't take out 4 teeth? We just take out 2. Is it okay? And then
Okay.
I also, when I went home, I begged my dad. I said, please don't take out 4 of my teeth. Can we just take out 2 or 1 or 3, just not 4? Yeah. Actually, I didn't start off my treatment taking out 4 teeth. I only took out 2 teeth at the start.
Oh, okay.
Yeah, and the buried tooth. But this actually caused my treatment to drag on for very long because midway through, the results weren't ideal.
Okay.
And I can still remember my orthodontist sat me down and she told me, are you very sure you want to finish your treatment like this? Are you sure you will not regret when you get older? I don't want you to look back and regret not taking out teeth and not getting the ideal outcome. Yeah, so subsequently, I followed her advice. So eventually, I had all the 4 teeth removed, but I was on braces for 4 years. So I was a terrible braces patient. I remember not flossing, not really brushing well, and also not wearing the elastics or the rubber bands that my orthodontist told me to. So it was quite funny because I always thought I could fool her. When she asked whether I wore my rubber bands, I would always say, yeah, but actually I didn't. But now becoming a dentist myself, actually we can tell whether patients have been wearing their elastics or not. So I think looking back, she was just very nice not to call me out. Yeah. So after going through all of that, I think I have a better understanding of how patients feel. I have more empathy. So when patients ask me, why do I need to remove 4 teeth? Why can't I just remove 2? Can I get a discount? I can understand where they're coming from because I once felt like that as well.
So we come to the last question, and I'm sure everybody love to debate about this, is whether or not dentists have great work-life balance. So is that true?
What do you think, Cici?
Well, I think after hearing from you from the dental school side and how you have to find patient and then you hold multiple role as a receptionist as well, and then you're also the doctor yourself, I think no.
No?
I think no. Yeah.
The good news is that it does become better after dental school, but it also depends on which specialty you choose. So for a specialty, for example, like oral surgery, they go on call very often because they manage trauma cases, facial fractures. So they are usually on call and they work very closely in the institution setting. As a dental officer, once you graduate, depends on which posting you get. If you are working in a hospital setting, most dental officers would have to go on call. But I would say it's not that often and it's still manageable. But in private practice, I think whether you have work-life balance or not would depend on how you plan your schedule as well as how many sessions you choose to take. So you do have more control in that aspect. There are some dentists who choose to take on all the weekday nights and the weekends, but there are also some dentists who don't. So it really depends on how you manage your schedule. I wouldn't say that being a dentist automatically guarantees a work-life balance, because honestly, that's what I thought before I chose dentistry, and that was what my dad told me as well. But I think ultimately it depends on how you manage your time and whether you are fighting for that work-life balance or not.
So a huge thank you to Dr. Wang for sharing her experience and insight into the dental world.
Thank you for having me.
So is there any resources available for students to find out more about dentistry?
So I post on my socials about life as a dentist. I also run a small blog where I share also about things that I've learned as a dentist along the way.
We will paste it in the link below. We hope you enjoyed this episode and give you a better idea of the dental world and how the journey is going to be like. So we'll see you on the next episode.